Hello and welcome to the Loddon Mallee forum on coronavirus, COVID-19. My name is Bob Cameron. I'm the chair of Bendigo Health. We have a panel here this evening and we're all socially distanced, and as each person talks, they'll take their mask off to aid with communication. This evening is about giving information so that you can make an informed decision about vaccination. We're going to detail why you should be vaccinated, what you can expect when you get vaccinated, and also how to do it. It's also going to be discussed why, as a community, we have to come together to try and reach herd immunity and just how important that is. We want to hear your concerns and hopefully we can give you the answers so that you are then going to be informed. On your screen, you'll have a Q&A button, and we want you to put your questions up so that they can be answered. Last week was a big week. In the Loddon Mallee region, we had 5,000 vaccinations, 4,000 of those in Bendigo out of public units. And as you know, the vaccination rollout is a federal responsibility, but the state government, through public hospitals, has also come to the party to make sure that we can supplement that program. Given the huge events of the last week, actually, the public hospitals have been the bulk of the program, but we hope that we see more vaccinations with GPs in the very near future, as well as in pharmacies or other outlets, so that as many people as quickly as possible can be vaccinated. We also want people to book, and if you want to come to a vaccination centre that we operate, go to the Bendigo Health website and you have to register your interest. Within 24 hours, you'll get an email back to have a booking link, and you will then be able to choose a date and a time of those that are available. The phone system is running extremely hot everywhere, and it is very, very slow. So the best way to do it is to do it online and to get an email back. We know what to do. We've been here before. The difference this time is that there is a vaccination available, and that's what we want to discuss, just how effective that is going to be in our fight with coronavirus. We also understand that there is an element of hesitancy, and that has to be confronted, and we hope that by questions and answers tonight, some of those issues can be dealt with. So I'd like to introduce to you people on the panel. We've got the Bendigo Health Infectious Diseases physician, Andrew Mahoney, who has been the leading physician in the region during the course of the pandemic. We've got Andrew Gay. Andrew is the nurse unit manager for the Vaccination Clinic. And we also have Alicia Stark, who will be joining us on the web. And Alicia is from the Department of Health's immunisation program for COVID-19. So I'm now going to introduce to you Andrew Mahoney. Andrew.
Thank you very much, Bob. It's plenty of numbers. You just talked about the vaccinations. It's also important, as you mentioned, to reflect on the last week, what we've all been through, and obviously we're unfortunately now back in lockdown, so it is a sense of deja vu. So what I really wanted to talk to you about in some ways may have been, I guess, helped along by that fact. Why should I get vaccinated for COVID-19 now? Thinking back on the last year, it's hard to take account of what we've all been through, but this is the current state of play with COVID-19 around the world. I just wanted to remind you all exactly what is going on the global sense, because it does have implications for why we all need to get vaccinated. So to date, you can see this is the actual count of cases in the red. This is data that's available online through Johns Hopkins University, about 170 million cases as of this morning, many millions dead. The pleasing part on these graphics now is the number of vaccines administered around the world. So it's a massive number, 1.8 billion doses of vaccine so far. So we know a lot about these vaccines. That's how many doses have been administered thus far. But you've got to remember, though, that most of these vaccines that are around the world are 2 doses. So we've still got to divide that number roughly in half And you see that perhaps 1 billion of the world's population has been vaccinated so far. Still a huge number. We've got a long way to go. There's another 6 billion people to be vaccinated. So that's just the world's context. Putting it into the situation now, though, in Australia, but more particularly Victoria and Melbourne, of course, outbreaks are going to keep happening, as are lockdowns. We've had leaks for a number of reasons through hotel quarantine, return travellers from overseas. You all know the story. I'm not going to go over it again. But the same thing has been happening in other countries, and it's worth just reflecting, I think, not only on the Melbourne situation, which we all now know well about, but what happens overseas as well. For example, in Taiwan, there was no cases for many months. They were really held up as one of the best places in the world to be for COVID-19. Now, their vaccine rollout was, in many ways, somewhat similar to ours. It was slow. People hesitated. They wanted to wait for a so-called better vaccine. And in fact, COVID-19 testing also dropped off quite significantly in Taiwan. So they were testing far fewer people than they were at the height of the pandemic last year. And they also loosened up some of the quarantine rules around certain return travellers. And unfortunately, as a result of this, just in the last month, there's been a huge outbreak in Taiwan, hundreds of cases every day. People are dying. So the red bars on the graph here are the number of cases per day in Taiwan. The white on a smaller scale, but unfortunately, is the number of people dying in Taiwan per day. And the green, the scale on the x-axis along the bottom is different. This is the vaccine rollout over the last few months. And you can see slow to take off until May, when in light of the outbreak, they've really got their act together. But a long way to go. Their population in Taiwan is actually quite similar to Australia, a bit more than Australia's. The area is obviously quite different, so the vaccination rollout itself should be easier in some ways, but they've got a long way to go. Similarly, in Singapore and Vietnam, countries where we've again been told what a great job they've been doing with COVID-19 controls and very few cases, the same situation is really being seen. So it's not just, unfortunately, Melbourne that's suffering through COVID-19 this year, but our next door neighbours in many ways are having the same experience as us. And I think the message to really take away from this is that vaccinations are what we need to get through this pandemic. You look at other countries, for example, the United Kingdom, even the United States now has really made huge gains in vaccinating their population to the point now where they're able to start offering vaccine to the rest of the world, which is really where we want to be to get out of this COVID-19 pandemic. You would have heard all sorts of numbers over the last 6 months about how good the vaccines are, which vaccine is better. That's really just a marketing term, I should say, because both vaccines work incredibly well. The vaccines that are in Australia's stockpile at the moment. So in terms of stopping you from getting sick with COVID-19, but more importantly, getting really sick and needing to go to hospital and even dying from COVID-19, there's really not much difference between the vaccines at all. This is just a summary table going through all the different scenarios of Pfizer vaccine versus AstraZeneca vaccine with what the studies have come up with various numbers, hence why there's a bit of a range with these percentages in the table. But really you can see there's not much to pick between the 2 doses of Pfizer versus 2 doses of AstraZeneca. You'll note that some of the data is not yet available because of the longer time delay between the 2 doses of AstraZeneca. So Pfizer vaccine is 2 doses 3 weeks apart, whereas AstraZeneca is 2 doses 12 weeks apart. Some countries have done it faster because they've had to respond to their own local situation. But the current recommendation, which is what we're doing in Australia for AstraZeneca, is 2 doses 12 weeks apart. So you can imagine that we don't quite have as much data on how much extra protection you get after the first dose for the second dose at this sort of level. But you can be guaranteed that those percentages are going to be higher than after the first dose, because that's the nature of vaccination. The first dose is to get your immune system primed. The second dose then boosts your immune system so you've got longer lasting protection. So it's basically certain that that second dose of AstraZeneca is going to boost those numbers you can see in the table higher up in terms of stopping people from dying, stopping people from going to hospital, stopping people from getting symptoms at all. And also we're getting more and more data coming through now. This is a big question over the last few months was, well, does it really stop transmission of the virus? The answer is unequivocally yes. We now have data coming through on that. So you're not just helping yourself getting vaccinated, you're actually helping your community, your family members, your household. It's a win-win. Just to bring up some very latest data for you on the B1617 variant, that is the current variant that's actually plaguing Melbourne as well as other countries in our vicinity. So we really want to know how good is the vaccine against what we're currently facing. Well, the vaccine effectiveness is shown here in some data from Public Health England. It's only published just last week, luckily for us. And again, you can see that 2 doses of any vaccine gives us about 80% protection from COVID-19. That is COVID-19 infection with symptoms. And there's a little bit of a difference again. You can see these numbers are very similar in terms of Pfizer and AstraZeneca. The numbers you would have seen that have been bandied around, Pfizer originally 95%, AstraZeneca 60-something percent. Well, actually, the two vaccines are really not that different in terms of effectiveness. But people have latched on to the original numbers. The real life numbers, I think, are more important, and that's what we're really seeing now in terms of the two different vaccines. This is a more complicated graph, which I'll just talk you through in terms of how getting vaccinated protects not just yourself, but those in your household. So this is an odds. The y-axis is the odds. So what's the likelihood of getting COVID in your household? Say, unfortunately, you've been infected, but you've had a vaccine. And so it's the time along the bottom from your second dose of being vaccinated to the risk of people in your household becoming infected. And this is again split up between AstraZeneca, that is the ChAdOx1 vaccine, and the Pfizer vaccine, the BNT vaccine. And so if you can see that really, as you look at the left-hand side of the graph, if you've been vaccinated more than 14 days and you're unlucky enough to be one of those few people who does get COVID, your chance of infecting your household is about 50% lower than if you had your second dose of vaccine in a much shorter time frame. So that's really another reason why we need to be getting vaccinated, again, for our household's benefit, because we're going to be much less likely, if we're one of those few people that does get infection, of transmitting it to our household. There are two safe and effective vaccines I want to emphasise that we have right now. And there are other vaccines which may be coming later on. We've now had a deal signed with Moderna. The Novavax we keep hearing about, but it's not yet here. So really we've got Pfizer vaccine and AstraZeneca vaccine. Now these are the side effect profiles in the first few days after vaccination. And I'll talk a bit more about the more serious side effects that you would have heard about as well. But you can expect to be a bit sore in the arm. I've certainly had that experience myself after either of the vaccines. Really much of a muchness in terms of these immediate and first 48 hours worth of side effects. So we have many people having headaches, about 20% of people needing a day off work actually the day after the vaccine, particularly the first dose of AstraZeneca or the second dose of Pfizer. So it's really an interesting thing with the vaccines. More side effects after the second dose of Pfizer, more after the first dose of AstraZeneca. But these side effects are really, in the vast majority, mild. They go away after a couple of days at most. Can be managed with simple Panadol, Nurofen, those types of medications. There's a smaller percentage of people, obviously, who do need to get medical attention, and the hospital and our team, of course, is here to support those people as well as local GPs. One thing that's been on people's mind, and certainly the media's mind, of course, is AstraZeneca and the risk of blood clots, and I'm sure there'll be some questions around this. So this particular syndrome now has, it's got a name, that's TTS, that's Thrombocytopenia, Thrombosis with Thrombocytopenia Syndrome, which basically means clotting with low platelets. And the latest figures which came out last week showed that around Australia there have been 27 confirmed cases of this and a few other cases that are most likely but not completely confirmed. And that's from nearly 2 million doses that have been administered of AstraZeneca so far. This is again predominantly first doses. The risk of the second dose, some figures have come through from, again, the United Kingdom showing the risk is much lower after the second dose. So breaking it down into age groups, this is what the government has decided to do a risk assessment on who should get AstraZeneca vaccine, and we now have pretty good figures for Australia in terms of what your risk is based on your age. That's the biggest risk factor actually for these clots. If you're under 50, the risk is somewhere around 2 to 3 per 100,000 people given AstraZeneca. Those over 50, the risk is lower, closer to 1 out of 100,000. So we've really now able to tell people coming in, these are the actual numbers for Australia, and we've got other figures from overseas, but these are really important for our local communities. Also, we're now able to recognise and treat TTS, whereas a few months ago, this is a brand new condition. The recognition of it was perhaps not very quick, and the treatment was certainly not known, but we now have much better information about all this. So most of these people have been discharged now from hospitals, a few who have needed follow-up, and of course there has been one person unfortunately who died from this complication, the first person who had, or one of the first people in Australia who had this TTS. So that's on everyone's mind. It's not like other blood clots, and I want to emphasise that if you have any of these conditions listed here, typical DVT, deep venous thrombosis, or you've had pulmonary embolism, if you've had a predisposition to blood clots, you've got a gene that might increase your risk of blood clotting, or a family history of blood clots, if you need to take blood thinning medications, if you've had a stroke or a heart attack, or if you have low platelets, your risk actually is not increased of TTS. And that's important, obviously, for a lot of people in the community who are naturally worrying about their own personal risk. But we know now from these cases, both Australia and overseas, that these conditions don't increase your risk above anyone else of a similar age. Anaphylaxis is a much more immediate side effect, which we have had some possible cases of in all vaccination clinics around Australia, and certainly Andrew might talk to you more about the excitement that generates. Probably not excitement is the right word. This can happen with any new medication, any vaccine. The risk is very low, but all of our immunisers are extensively trained in the recognition of anaphylaxis and also the emergency treatment of it. So a few people have ended up in emergency departments with this, and all of them have been fine, I can happily say. So I just wanted to acknowledge Andrew Gay's team of vaccination immunisers. They've been doing an amazing job lately. The pressure obviously is increasing. The Bendigo Health Pharmacy have been integral in the rollout of the vaccine to the Loddon Mallee region. Our local public health unit, who are very busy as we speak in the contact tracing area, and of course the Department of Health.
Well, thank you, Andrew, and we'll now hear from Andrew Gay, who is the Nurse Unit Manager at the Vaccination Clinic.
Thank you, Bob. Thank you, Andrew. You're a hard act to follow. Speak beautifully as usual. So obviously vaccination's ramping up, which is great to see. We've moved into our new location at Mollison Street. Over the last week, as Bob alluded to, we've done over 4,000 vaccinations through that site, which actually far exceeds my expectations considering the staffing that we have at the moment. Currently we have AstraZeneca available to anyone aged 50 and over, and this is also available through the sub-hub locations at Castlemaine, Mildura, Swan Hill and Echuca, and obviously through some GPs and pharmacies as well. Pfizer, we do have available in clinic, and we're assisting to deliver Pfizer across the Loddon Mallee region through our outreach programs, and currently working actively towards accreditation of these sub-hubs as Pfizer sites. Certainly the cold chain management of Pfizer has changed recently. There's been some studies by Pfizer to ensure that it's safe to store at 2 to 8 degrees for up to 30 days, which logistically makes it much easier for us to manage our stock movements around the biggest quarter of the state. In terms of booking in for an immunisation, as Bob stated in his opening, the best way is to register your interest for a vaccine, which can be done through the Bendigo Health website. There's a QR code there and the web address for you to follow, or alternately you can do it through the 1800 number provided by the Department of Health and Human Services. Obviously that is under a vast amount of pressure at the moment with increased demand for vaccination, so please be patient with any of these processes. We know there are wrinkles in the booking systems. It may be that all bookings have been taken up for the slot that you're looking for, so be patient, try again, try for another day. In terms of the immunisation process, moving your way through the clinic, once you've been registered your interest for a vaccine, you'll be sent a link to book for that vaccine. And when you attend the clinic, we ask that you bring your driver's licence and your Medicare card. The more records that we have, the better we're able to link your vaccination episode to your Medicare records so that you can then retrieve those records whenever you need them. Concierge staff are on site to help you with your passage through the clinic, and we hope to make it as smooth as we possibly can. Walk-in appointments are available, but probably not our preferred method. If you can book, that's fantastic. That's a much more controlled way of gaining access and ensures that we have a bit better management over our stocks of vaccine. We may get to the point where walk-in demand exceeds supply. So to be sure that you're going to be receiving a dose when you turn up, it's best that you book if you can. So walk-in capacity, as I've said, will be potentially limited by either staffing or by vaccine availability on any given day. And we'll endeavour to update changes in circumstances via the Bendigo Health social media channels and on the Victorian Government website. Side effects and what to expect. Andrew's covered that beautifully, but generally the very common side effects are pain and swelling at the injection site, tiredness, headache, muscle pain, chills, fever, joint pain. All can be managed with simple paracetamol or Nurofen at home. If you do experience more severe or persistent side effects, obviously we want you to seek medical attention. So those headaches that with onset of around 2 to 3 days duration after your vaccination and persistent headaches or abdominal pains must be investigated. So present to ED or to your GP. If you are concerned about receiving one brand of vaccine over another, which we know a lot of people are, your GP is probably your best source of information. And it's a discussion that should be had before you come to the clinic. You really should be presenting to us with that decision made to receive a vaccine. So if you're over 50, you have the expectation that you'll receive AstraZeneca. If you're unsure about that, make sure you've had that conversation with your GP before you come to us. If appropriate, if you do have any of those very specific and limited blood clotting profiles that Andrew has mentioned, then your GP can make a referral to the Victorian Specialist Immunisation Service, and that will be duly considered and a suitable outcome made based on that referral. And ultimately, it's important to remember that the risk of blood clots from any vaccine is far, far less than the disease itself. Access across the Loddon Mallee. We have, as I've stated, sub-hubs set up across the state, across the region I should say, including Castlemaine, Echuca, Swan Hill and Mildura, and we're making regular visits to those sites with Pfizer to assist with their vaccine delivery. As we gain capacity with staffing and the delivery and use of Pfizer across those sub-hubs, we'll reach out to smaller communities as well. And of course, the Murray PHN is assisting with the parallel rollout of the vaccine delivery through the Commonwealth program in conjunction with companies such as Aspen Medical into areas of Commonwealth responsibility such as supported residential services and private aged care. And we have been experiencing shifting targets and felt like we've been on quicksand at times. Obviously, there's a balance between demand, between staffing, between availability of doses. So the best way to ensure a smooth rollout is to book an appointment for a vaccine and to please be patient with the staff. They're doing the very best under very trying circumstances. Thank you.
And now we're going to have a video with Lynn Harrison.
Well, my husband and I love travelling. Every couple of years we love to get overseas and see new things. When we got back to Australia, we would have to self-isolate for 2 weeks. And that was fine. There was only Doug in my world and only myself in Doug's world. But one day he was talking to his daughter on the phone from Melbourne, and she obviously was a bit concerned about Doug. She rang Doug back, he answered the phone and she said, "I've called COVID hotline, the ambulance is coming out to pick you up." They came, they said Doug was okay, but they would take me in. So they took me in, they did a test of me in the hospital, and the next day they rang and told me from Melbourne that yes, I was positive, that I had COVID. But in the meantime, Doug's daughter Susan arrived up from Melbourne the next day and decided that he had to go to hospital. So he was there, and I've since heard that he was very, very sick, and the nurses were concerned that he would not make it through the night. Once in hospital, I deteriorated greatly and very fast. And in the end, I was put in intensive care on life support, where I stayed for nearly 3 weeks. Wasn't much fun, but I can't remember much about it either. The only thing I can remember about in the hospital, in intensive care, was the nurses saying, "Now I want you and Doug to say goodbye to each other." Do you know how hard that is? Saying goodbye to someone that you love. And I said, "Final goodbyes," and she said yes. So I was then taken from the ward into intensive care. The nurses up there were just fantastic with the girls. They would take photos of me and they really kept them up to date with what was going on. So they were just terrific. It was tough. They went through a lot more than I did. Yeah, they didn't know what to expect. The doctors told them not to expect me to come out of the coma. We were so sick, I think. I don't know how Doug felt, but I think I was so sick that I said my goodbyes and I was just battling to survive myself. I don't think I gave it much more thought because I was too sick. All being told, I was in hospital for nearly 7 weeks and I was in intensive care on life support for almost 3 weeks. Doug was in hospital for 10 days, but our lives were very critical at different points. Yes, I still had a long way to go. Just standing up, having a shower, being able to do things still had a long way to go. Both Doug and I still haven't got the stamina to do what we did beforehand. We find that we get worn out quite easily, something that we would have taken just for granted, we can't do anymore. Doug and I can't remember much at all. We just slept through it. Well, I did. I just slept right through it. But the family, it's been really, really hard. We've got videos there of the little kids saying, "We love you, get better soon." I mean, everyone was touched by it. There was no COVID vaccination when we got it, but there is now. Protect yourself and have a vaccination.
Thank you for that video from Lynn Harrison. We're now going to hear from Alicia Stark, and Alicia is with the Department of Health COVID-19 immunisation program. Over to you, Alicia.
Great, thank you. And just triple checking that you can hear me.
All good.
Excellent. Great. Hi, thanks so much for having me. My name's Alicia Stark. I'm the Director for Engagement and Partnerships at the Department for the COVID vaccination program. I'll just give you a bit of an overview this evening of where we're at with the program, how that links into your catchment area. Some of this information I will just skim over as it's already been touched on from our other speakers for this evening, and then really keen to hear your questions at the end as well. So the Department of Health have set up the Victorian vaccination rollout, sort of looking at 3 main pillars. They focus on access for all people living in Victoria, that it's rolled out with the highest level of safety and quality, and that we build and maintain public trust and confidence throughout. I know we've already touched on this briefly this evening, but we're always getting a lot of questions around who's eligible under the current phase, given that we've added groups to this from the beginning. So we started our rollout on the 22nd of February, and that has evolved since then as to who is currently eligible, where they can go and what kind of vaccine they can get. So as of last Friday, all Victorians aged 40 and over were eligible for the vaccine. Any Victorians aged between the ages of 16 and 40 were eligible if they fit within one of the current workforce or community population groups that deem them eligible for vaccination. So I know we've touched on this already this evening, but those people aged under the age of 50 are currently able to access a Pfizer vaccine, and those aged 50 and over will be offered AstraZeneca. I'll give a quick overview of the groups who are aged under 40 who are currently eligible. So in the initial rollout, we had a group that we referred to as 1A, and they were workforce groups mainly who looked after our borders. So we had airport workers, hotel quarantine workers and maritime workers who came into contact with international arrivals. We also had our frontline healthcare workers, so that included those working in health services in ED and ICU and COVID wards. It also included our paramedics, it included staff working in our pathology services, and also our staff working across our COVID testing spaces as well. As part of the 1B rollout, we've expanded the eligibility much further. We also now include all other healthcare workers. So any person who works in a healthcare setting is now eligible to come forward for vaccination. It also includes people working in corrections environments, anyone working in emergency services, those working in meat and seafood manufacturing and distribution. All of our transport workers are now included as well. And we've also opened up to those people living within high-risk accommodation settings and people within the disability and aged care sector as well. So that covers clients and residents. It also covers workers and volunteers and students who are on placement as well. As of early last week as well, the Commonwealth had expanded the eligibility criteria to also include people who are travelling overseas for essential travel to be vaccinated prior to departure with the vaccine based on their age. As part of the rollout here in Victoria, we offer vaccination through a range of channels to make sure that accessing the vaccine is convenient and easy for everyone. So we offer that through our hospital hubs and our spoke sites that we've touched on a little bit tonight, through your GP or primary care pathway. We also offer that through, there's some options for mobile vaccination where we're attending specific sites or in reach in some locations. We're also doing it through our community health networks and then a range of our Aboriginal community controlled health organisations as well. In relation to the clinic locations, I know we've touched on them in this catchment already this evening, but statewide, we now have over 30, almost 40 open access vaccination clinics, which means that any person who's eligible that lives in Victoria will be able to access this clinic by making a booking, and in some cases, they may take walk-ups as well. We obviously also offer it through the primary care network, so potentially your local GP may also offer a vaccination that you would be able to access as well. Sorry, I'm just going through some slides to keep myself ahead of what I'm meant to be talking about. So as of last night, progress on the Victorian vaccination rollout was that we'd administered just over 475,000 vaccines across our state-based services. That includes just over 400,000 in first dose. And we did yesterday see a record number of vaccinations at over 16,700. Some of the challenges that we're facing at the moment that I'm sure, they're widely publicised. The challenges that we see around the perceptions of Pfizer versus AstraZeneca. The information flow coming down from a Commonwealth program that's being implemented by the state. And then the last one is around vaccine supply and demand. So we've briefly touched on the call centre booking option this evening. So that's through our 1-800 number. So it's 1-800-675-398. As to be expected, given that there has been an outbreak in Victoria, we are experiencing unprecedented demand within the call centre. So we do understand that there are longer than usual wait times. Normally, our wait times average about 40 seconds to be able to get through to make a booking, but we definitely note there are some challenges with getting through at the moment. And we will be looking at offering other options in the coming weeks as well for how people may be able to make a booking. We do also display on our website where there are sites that have walk-up options. We do update those periodically throughout the day to give a bit of a steer on wait times on walk-ups to clinics as well, so that people can check and make a decision potentially before they leave the house, because we have been noting again walk-up wait times at the moment are much longer than what we have experienced in previous weeks. And that's probably it from me in terms of what I got to present, but I'm really keen to hear questions as well. Thank you.
Well, thank you, Alicia Stark. And we lost you a little bit before, Alicia, but Andrew Gay was able to set out the website, the Bendigo Health website, as to where people can register and to book. And we've encouraged people to use email and to use email as a form of communication because it will be much quicker than anything that involves a telephone, given the huge demand at the present time. We're now going to open it up to questions that we've received, and we'll start off with Genevieve, who says, can you get vaccinated if you've got a cough or a cold? Dr. Andrew Mahoney, what do you reckon?
Well, the first thing is, have you got COVID, I suppose, at the moment? So we would want to be making sure you've been tested for that and making sure you're well would be the first thing. And you're making sure you're not someone who has been to an exposure site, of course, in the current situation. We may not have been saying that in the last few weeks ago, but anyone with cough or cold symptoms should be tested. That's really, hopefully goes without saying. If you have a negative test and you're improving, then the question is, yes, should you get vaccinated in that situation, I think. We wouldn't want you coming in when you're coughing and sneezing all over the place because, first of all, we want you to be well as possible, but also we've got our staff who we've got to be mindful of as well. So if you have got minor symptoms that are improving, then getting vaccinated shouldn't be a barrier, but we want to make sure you've been tested for COVID, of course, and are improving before you came in.
And Abby asks, if you live in Pyramid Hill and you're in the 40 to 49 age bracket, where can you get a COVID vaccine? Andrew Gay.
Yep, thought that would be for me. So for the moment, we're obviously not reaching out to Pyramid Hill specifically, but obviously when we are delivering Pfizer out to, I don't know, is Swan Hill closer to Pyramid Hill? You could perhaps book an appointment there. Otherwise, we're available to you here in Bendigo to visit.
And what are the symptoms of a blood clot, Andrew Mahoney?
Sure. So the types of clots that have been particularly seen with AstraZeneca are unusual blood clots. And Andrew mentioned already headaches. That's because one of the types of blood clots has got a long name. It's cerebral venous sinus thrombosis, CVST. It's an unusual type of blood clot, very different to deep venous thrombosis and pulmonary embolism. So it's actually a blood clot in the vein that is around the back of the brain. That's where this particular clot is being seen. The other type of unusual blood clot that's been seen is actually in the abdomen. Andrew mentioned abdominal pain. So the main symptoms we're concerned about in the post-AstraZeneca period of time, day 3 to day 21, are really persistent headaches, persistent unexplained abdominal pain. There are reports of other people with more typical clots, for example, in the legs and so on, but they're actually the exceptions. The clotting has been quite unusual with AstraZeneca vaccine.
Now, we've had a query how long between from a first to a second shots, and Andrew Mahoney has set out that it's 3 weeks for Pfizer and it's 12 weeks for AstraZeneca. But Andrew Gay, when someone comes into the clinic, do they leave with an appointment, or how does that work?
Absolutely. So we endeavour to put your second appointment in when you present for your first dose. And you do have a little bit of leeway. Pfizer, anything between 3 and 6 weeks is acceptable. And anything after 4 weeks for Astra, but 12 weeks is obviously the benchmark when you're getting that highest efficacy or effect. So stick as close as you can to those target dates.
So everybody leaves with a date in their hand?
They do.
And if you've booked an appointment, when you go there, when you go to the vaccination clinic, how long would you normally have to get there beforehand? And do you have to wait in a long queue, or are you given some sort of priority?
Absolutely, bookings are given priority, so don't just sit at the back of the queue because it's likely to be the walk-in queue. Make yourself known to the concierge staff, let them know that you have a booking. You will be prioritised. Just like the GP though, you may have an appointment at 10, there may be a little bit of a wait time, so do be patient. It probably doesn't hurt to arrive a little bit early, sort of 10 or 15 minutes before your appointment, and we'll squeak you through as quickly as we can.
And John asks, you know, the to-the-point question, if I get a vaccine, will that stop me from getting COVID? Andrew Marnie, give us your expert opinion.
Well, the vaccine will definitely stop you. When I say definitely, I mean there's an extremely good chance if you get your vaccine, you're not going to be ending up like Lynn in intensive care with COVID. So the chance of being hospitalised, being sick enough to get in hospital, intensive care or dying is almost completely eliminated. The vaccines themselves, the numbers that you would have seen on those tables I showed earlier, Pfizer versus AstraZeneca, which I think is an artificial comparison, really we're talking, in terms of getting any symptoms at all, we're talking 60, 70, 80% chance of not getting those symptoms at all. There is obviously asymptomatic infection with COVID. It's hard to detect those patients in clinical studies because you'd have to test everybody, even those who don't have symptoms. But even then, we know that the risk of getting asymptomatically infected is also very much significantly reduced with either AstraZeneca or Pfizer vaccine. So the short answer is it won't stop you getting COVID completely, but it'll make you, it'll keep you out of hospital and getting sick with serious, severe COVID.
Now, Cindy says that she's not good with needles. Are you able to accommodate that, Andrew?
Absolutely. We've got very experienced vaccinators who are really good at distraction techniques. And if you're needle adverse or a fainter or whatever, we can accommodate that. We do have facilities to allow you to lie down for your vaccination if required. And the team are really good at taking your mind off what's going on.
And Alan from Northern Victoria, she wants to know if there'll be walk-in vaccination centres in Bull Oak, Swan Hill or Kerrang.
I hope in time, with building staffing capacity, we should be able to support Swan Hill, Kerrang to provide walk-in services. Once we get out of the bigger population centres and certainly have more staff on board, we are really looking forward to setting up pop-ups for vaccination in all of the little communities around the Loddon Mallee region.
And if we go particularly to the very small towns, as we see in the Mallee, GP services, are they readily available?
GP services are available, but at this point in time only for AstraZeneca.
Yes.
Yep.
So that's an important thing for everybody to know. If you're over 50, you will get AstraZeneca. You can get that at a GP who's doing it. But if you are under 50, you can get Pfizer, but you cannot get Pfizer at a GP. You have to get it from one of the state clinics. Is that right? And at the moment, that's Bendigo, Echuca, Swan Hill and Mildura.
And Castlemaine.
And Castlemaine.
Yep. Yep.
We have a question there. Do I still need to get a COVID test if I'm sick and I'm fully vaccinated? Until
we've got that herd immunity that you mentioned earlier, Bob, that is 70, maybe 80% of the population vaccinated, the answer is going to be yes. The reason being, as I mentioned earlier, we don't get 100% protection with any vaccine, and the COVID vaccines are just another example of that. So because we're obviously in a situation at the moment, in particular, where we've got an outbreak, we want to detect every possible case. If you've got symptoms, regardless of your vaccination status, please get tested because we need to know. And just on that matter of herd immunity, you mentioned a figure of 80% of the population. Does that mean it becomes so much more difficult for there to be a spread of the disease? That's right. So herd immunity is essentially having enough people vaccinated such that there are not enough so-called susceptible or unvaccinated people for an infection to spread, that it just won't be able to get enough momentum up. That's what we're really aiming for with this vaccination campaign. Now, Kate says that she has issues with the thickness of her blood, and she's in the AstraZeneca age bracket. She's over 50, and she wants a vaccine, but she's concerned about her history. Is there a current blood test that I can do to allay my concerns? So I just need a bit more specific information from Kate or perhaps her GP as to exactly what the condition may be. The vast majority of people in this situation have a condition that actually doesn't increase their risk of AstraZeneca thrombosis with thrombocytopenia syndrome. So what we'd need to hear really is either from Kate or ideally from the GP exactly what the condition may be and whether that may or may not be one of the very rare conditions that is a contraindication to AstraZeneca vaccine. But those conditions are very rare. We have, as Andrew mentioned, the Victorian Specialist Immunisation Service. We have capacity here to take those calls from GPs and then determine on that base of the history what's the right vaccine for each individual.
And at the vaccination clinic, Andrew Gay, you've got a doctor there?
We do, yes. We have our Deputy Chief Medical Officer on site for most days of operation. Otherwise, we have very well-trained staff who are quite capable of responding to the deteriorating patient and escalating care.
And understand all of those issues.
Absolutely.
That's reassuring.
Yep.
We have a question here from someone who's pregnant, or if someone's considering becoming pregnant. Can they be vaccinated safely? What's the current thinking around that?
It's a good question, and congratulations if you're pregnant. But at the moment, we don't have a lot of data around safety of vaccination in pregnancy. There were some people who were in the clinical trials overseas who were pregnant when they were vaccinated. They didn't know they were pregnant. The outcomes from those pregnancies have been fine. And there's no actual reason to fear why these particular vaccines would be a risk to the child. However, because we don't have all the data yet, the data is slowly coming through from overseas. The current recommendation is if you're pregnant to not be vaccinated. If you're considering pregnancy though, these vaccines don't hang around in your body for months and months and months. It's really the immune system response that hangs around for months. And actually that's good for the baby to have that immune response, if anything. So if you're considering becoming pregnant, that's fine. Go for it. You can also go for your vaccination as well.
Alan says that it's a shame that if you come from a small town that you have to go some distance to get vaccinated, and wonders if more vaccines will be made available in rural towns. Alicia, can I throw to you here? Do you know if the Commonwealth is going to expand their GP program to include many more GP practices so that there can be a broader reach out into the community, just like what we would normally see with flu shots, for example?
Yeah, I know that certainly it's up for discussion all the time with meetings with the Commonwealth. So yeah, certainly that's something they are considering going into the future. They'll also be looking at our vaccine supply from a Victorian supply perspective as well, to hopefully increase that over the coming months so that we're actually able to provide the catchment with more vaccines to be able to reach more areas. So it's twofold.
Now, Melinda says she has a son who's 22 who has type 1 diabetes, and he had his first shot of AstraZeneca, and that was back when prior to the ruling about the 50-year-old. So he's 22, he had his first shot of AstraZeneca, and he had a very bad reaction to it. Should he get his second shot?
So I'd want to know a bit more from Melinda about her son's reaction specifically. What was the nature of it? Was it an immediate reaction? That is, it happened within the first hour or so, or even less after the vaccine. That's a potentially really serious, very rare type of reaction. But I'd need to go a bit more through that with Alicia, with Melinda and her son, as exactly what happened. So we, as I mentioned, we are a referral service for these types of reactions where we go through the process. We have calls from the vaccination centre as well about immediate reactions. In terms of what's happened, it all gets reported through as a safety and monitoring system, SafeVic, which runs in Victoria. So these type of reactions ideally have been recorded, so we have good data, but also we know what advice to give to individuals like this. So it'd be worth just sitting down with Melinda, finding out exactly what happened, and then determining whether the second dose is safe. And if it was an anaphylactic reaction, then we would not be proceeding with the second dose. We'd be switching vaccines. If it was not an anaphylactic reaction, then it really comes down to a more granular level of what actually happened. And at the very least, we'd be obviously wanting to monitor that individual with the second dose. We have a system in place where people who have had a history of certain reactions do get an extended period of monitoring straight after their dose of vaccine.
Mm-hmm. I suppose that's one of the benefits of going to one of the big vaccination clinics, like at Bendigo, where you've got someone like we have with the Deputy Chief Medical Officer, who has a very, very extensive knowledge around these things.
Sure.
Why are there two types of vaccine?
So there are actually more than two types of vaccine. There is probably 4 or 5 types of vaccines actually. It's really been a race to produce these vaccines since what happened late 2019, obviously throughout 2020. So there have been companies largely overseas. There was obviously a Queensland vaccine that was being put up, but we won't talk about that tonight. And really these companies have different production lines making different types of vaccines. And the two vaccines that we have in Australia just purely because they've come from different companies which are experts in, for instance, mRNA vaccinations, whereas the Oxford vaccinations are a different type of vaccine as well. So that's why we've got two types in Australia, but there are more than that actually overseas. For instance, there's Sinovac, people may have heard of that. There's a Sputnik vaccine. There's actually a whole number of vaccines that have been produced in various countries around the world based on their local expertise. There are many different types of vaccines in general. We have more than two types of influenza vaccine. We have different types of all sorts of vaccines, actually.
So there's currently 2 approved in Australia, but you mentioned before that it's possible that there might be some more approved later in the year.
Well, that's right. Novavax is one that Australia has put a pre-order in, and we're obviously keenly waiting on that arriving. It has not yet been approved for use in Australia. The data around the clinical trials has been a bit slow to come through as well. So that's one thing that's slowed down Novavax at this stage, but it's certainly on the list for vaccines that will be coming to Australia.
Now, we have a query there. Some people are nervous about getting a vaccine that's so new. So should be, and I want you to sort of give us an answer to that while a vaccine might be new in time, it's actually, there's a whole lot of experience where you've talked about the 2 billion people, or the 2 billion shots that are being given.
Yes, so if you think about a new medication, there's not many times we have 2 billion people who've had it and we know what happened afterwards. So there's a lot of data around safety we already know. Now people might then ask, well, what are the long-term side effects? And that's a good question. We don't know, to be honest. But you think about all the history of vaccinations around for the last, nearly century, I guess, if you go back that far. There have been vaccines, of course, that have never made it this far. In fact, the 2 vaccines we have are really the best of the whole field. There's been dozens of vaccines that have not gotten this far for whatever reason. They didn't work. There were issues with the production, or they had possible side effects. So to get this far, the vaccines have already gone through a very rigorous scrutiny. And so when we say new, well, they've already come a long way in terms of the number of people who've had the doses. They've already gone through clinical trials like any new medication. But the technology as well, people wonder about mRNA vaccines because they haven't heard of that before, but actually the technology has been around for a few decades actually. And so these are not technologies that we know nothing about. There are other vaccines along these lines which are used for infections that we haven't really needed to roll these vaccines out for. For example, the AstraZeneca vaccine has some similarities in the way it works to the Ebola vaccine, which we've never had to obviously need in Australia. So we have a track record of knowing what are the possible risks with these types of vaccines. So they're not actually as new as what we perceive them to be.
And we have someone who's a mum in her 30s and she's breastfeeding, and she has an autoimmune illness, and it's been suggested to her that she should have a Pfizer vaccine when she gets it, but she's heard it can affect your fertility, and she wants to have more children. What would you say to her?
I would say there's no evidence at all that these vaccines affect fertility, and so in many ways the question actually is not so much about hearing you can affect your fertility. It can't affect fertility. There's no way it can affect fertility. Again, these vaccines don't hang around in your body. They really just create an immune reaction, and that's what hangs around your body. Your antibodies are what hangs around your body, and these antibodies are not at all dangerous. They're a product of your own immune system. So there's no effect on fertility. I think I'd be going for it. Having another baby is perfectly safe.
And Andrew Gay, at the Bendigo State Vaccination Clinic operated by Bendigo Health, which you run, where's the best place to park?
Yep. Given that with high volumes of walk-ins there can be a bit of a wait time, the best place is probably McLaren Street. So there's free parking available on McLaren Street.
And Geraldine, she's on warfarin, as a lot of people are. Is there a preferred vaccine?
Most people on warfarin for example, atrial fibrillation, they've had a heart valve replacement, one of those conditions. And all those people, it's perfectly safe to have, in fact, either vaccine, so it'll be based on your age in that situation. There's a small number of people who may be on warfarin for a condition that's called antiphospholipid syndrome. This is a rare predisposition to clots. It's a very specific problem. And those people should have Pfizer vaccine. But otherwise, most people on warfarin, it's not going to matter. There's no increased risk from being on warfarin per se. Just the question would be, why is someone on warfarin? That would just be a question for the GP. Or the individual may well be able to tell us on the spot. Usually most people would be able to tell us straight away. Now,
Jason has a query. He registered on the Bendigo Health website on Friday, And we want everybody to register. And when you do that, there is a drop down as to which of the hub or the sub-hub you want to go to. That's Bendigo, Castlemaine, Echuca, Swan Hill or Mildura. But he wants to know, having registered on Friday, he still hasn't had an email back, and how long would he normally expect to hear back? Because when he hears back, there'll be the booking link and then he'll have the times to choose.
Normally Jason would have received a reply and the booking link within 24 hours, but unfortunately with the vastly increased demand, the people who would normally be pushing those emails out were managing queues and helping us with flow. So please be patient, Jason. We will get that out to you as soon as we can.
Lorraine says that she had her first AstraZeneca yesterday at the Mollison Street clinic, and she can just say all the nurses from Bendigo Health were so lovely and caring. So thank you. So please take that back to them, Andrew Gay.
I will.
We have another here, a question. Do I still need to get a COVID-19 test if I'm sick and fully vaccinated? I think we've dealt with a question similar to that previously. And we've got one more question to finish off the evening from May. Does a lack of spleen affect the effectiveness of the vaccines? And is there a preference in that case?
It's a good question, and not a lot of data out there at the moment about people who don't have a spleen, actually, for the effectiveness of the COVID vaccines. In general, having had your spleen removed may have reduced the effectiveness of vaccines, but also these people are strongly recommended to be vaccinated because it's actually another component of the immune system that's been removed in the spleen. So the vaccine response is usually actually pretty good. It may be a little reduced for COVID-19 vaccines. I'd expect that reduction will be actually very similar between Pfizer and AstraZeneca. So there's no particular preference in this case. It will be based on someone's age.
Thank you very much. And can I just thank you all for joining this Loddon Mallee forum. It's very important that people have been able to ask their questions, and I hope the answers that you've received help you in terms of your knowledge. And we have one last comment from Mad Cow. It says she's had the vaccine, she survived, and the nurses are lovely, and she loved the lollipop. So take that back, Andrew Gay. So to you, Andrew Gay, we wish you and all the team the very best. Dr. Andrew Mahoney, to you and all the team, the work that you've done, Casey Nottage, everybody throughout the Loddon Mallee, you've done a fantastic job, and we all look forward to that continuing. And we thank you very much for joining us tonight, Alicia Stark. So thank you very much and have a good evening.